Judd-Winn. I am the lead district nurse in Rugby for 28 homes, including learning disabilities, care homes and nursing homes. So I've been doing my role for just over 2 years now. Initially, before COVID, I was very instrumental in going into the homes to support the care homes with any district nursing needs. COVID hit and we embarked on the virtual ward rounds. So again, we set up the virtual ward rounds, got them running really smoothly between all of the homes and all of the GPs in Rugby. And then the word DOCOBO was mentioned to me. Didn't really have any idea what it was or what it was going to involve. Obviously, I had some concerns, as did the care homes, that we were going to roll it out to. You go into work every day expecting to use a hoist for your patients, go into work every day expecting to use DOCOBO for your patients, because in the long term, it's beneficial to them. Now DOCOBO's in place, they put all this information straight through to DOCOBO as and when something arises, and we can have a look at everything, look at the report, and we're ready to discuss it with an answer for them on the ward round. The second pathway is our monthly wellness checks. So every resident in the home should be having a monthly wellness check. That includes their vital signs, blood pressure, pulse, respiration rate, oxygen saturations and their weight. This is entered into DOCOBO. If any of their parameters alert, which that means that their vital signs are outside of the set parameters, I get an alert, and on a daily basis I monitor these. If we have two readings that are outside of parameters, I ask the care home to do a set of observations for a week, enter them into DOCOBO. I triage them and we then take them to the GP, and we've noticed already a huge reduction in the falls in care homes because patients have been on antihypertensive medication when their blood pressure is already too low. So by giving the medication, we're lowering it further and the patients are at risk of and are falling. So we've managed to reduce the risk of falls using the monthly wellness. The third one, which the care homes love, is the My Resident is Unwell. So if they've got a patient that they would normally ring the GP for, it could be a urine infection, chest infection, a new onset of confusion, anything that they would ring the GP for and ask for a GP visit, they enter all the details into the DOCOBO system. This is triaged in the ICC by trained clinicians. They then call the home back within 2 hours. Might be that they think this patient needs to see a GP, in which case they will arrange that for the care home. It may well be that a district nurse can go out and do a visit, or one of our advanced clinical practitioners, advanced nurse practitioners or clinical practitioners within a 2-hour or a same-day response. And they will then visit the patient at the care home and make a clinical decision about what happens next. It was a bank holiday Monday. They entered the details for all 3 residents through DOCOBO. They were triaged within 10 minutes by the ICC, and within half an hour there was a clinical practitioner on the doorstep. Within 2 hours, all 3 residents had been examined, assessed and had their antibiotics that they needed. Had this not gone through DOCOBO on a bank holiday Monday, these patients are likely to have been admitted to hospital unnecessarily. They would have been ambulance conveyance to hospital, a long wait in A&E to then be returned back home probably 12 hours later with antibiotics. But all 3 were having treatment within 2 hours. We're having some really positive feedback from the care homes, and I think the biggest one is that My Patient is Unwell. The fact that they don't have to sit, the staff don't have to be on the telephone holding on in the call for their call to be answered. It reduces their time. They can be with the resident, and the time that we can respond to them and treat them in their own home where they are the most comfortable has been the biggest positive that we've seen within the care homes. For myself, I think that we've managed to improve patient care, we've improved interaction with the GP service, and the fact that we're managing to reduce falls in the care homes has been a massive positive. I would like to see DOCOBO rolled out to all care homes everywhere across England. I think it has a key role to play in patient care, patient welfare, and also education within care homes for staff. My advice to any care home manager who's thinking about or has been approached about introducing DOCOBO into the care home is go for it. Initially it's daunting, like anything new technology. I can say that the support from DOCOBO and all of the DOCOBO staff has been absolutely amazing. You will be supported, you will be guided, and you will be helped all of the way. So fly the flag for DOCOBO.